have a juvenile onset diabetic with poor circulation and diabetic neuropathy. As you can see, these are diabetic ulcers with lymphedema and evidence of gangrene. Questions?
Any osteomyelitis?
None apparent, although not definitive.
Treatment?
To stabilize the blood sugar, consider antibiotics, possibly amputation.
What's her name? I was just wondering the patient's name.
Marjorie.
Hi, Marjorie.
Hi. Yes, thank you. Let's move on.
Please, doctor, without equivocation.
There is a family of diseases. It's quite rare. The leukodystrophies. Lorenzo has one of them. It's called ALD. What ALD is an inborn error of metabolism that causes a degeneration of the brain. It only affects males, usually between the ages of 5 and 10. Its progress is relentless. The end is inevitable. All boys with ALD die, usually within 2 years of diagnosis.
And there are no exceptions.
I am so sorry.
Are you absolutely sure?
Yes. Lorenzo shows the definitive sign. He has an abnormally high level of fats in his blood, certain very long-chain saturated fats. I would like to offer you some hope, but...
Then there's absolutely no treatment.
You know, normally at this point, we try to be constructive, we try to focus on what can be done. But in this case,
Hi. Patient has been complaining of back pain and night sweats. Blood tests and urine analysis are normal. MRI suggests a massive intradural malignant schwannoma neurofibrosarcoma extending into psoas muscle with nerve root compression syndrome and bone erosion. Growth extends from L2 to L5. We'll send patient for biopsy to confirm. Yes, question.
Sorry, I didn't follow that. Is there something wrong with me?
Yes, well, if you look here on your MRI, you see this cephalopod-like object that's spreading down your spinal column. That is a massive schwannoma neurofibrosarcoma.
Okay, so sorry, I just don't know what
It's a malignant tumor.
A tumor?
Yes.
Me?
Yes.
That doesn't make any sense, though. I mean, I don't smoke, I don't drink, I recycle.
Actually, your case is really quite fascinating because your cancer is the result of an incredibly rare gene mutation in chromosome 17p and p53 gene that causes the growth of liquid cells. It's good to be cautious for neurosystems and your cases. Your lower spinal spine. A 4-month regimen of chemotherapy is very aggressive dosage. I think that given the placement and size of your particular tumor, the wisest course of action is to see if we can possibly reduce this thing down to a more manageable size before we consider surgery. Now, chemotherapy can often result in fertility issues.
But I'm gonna be okay.
If you need someone to talk to, we have an excellent staff here at the hospital of social workers and psychologists. They specialize in these matters, and they would be able to help you. Now, as I said, you should...
Good morning, Adam. I'm Dr. Walderson. I'm going to be doing your surgery today. How you feeling?
Great, thanks.
Good. So we're gonna take excellent care of you. Surgical team is top notch. Just try to relax. See you later.
Thanks. What's this?
Standard paperwork, hospital liability and disclaimer forms, and organ donor authorization. Right there.
Okay.
Thanks.
I got a new coat.
Oh, yeah.
Brooks Brothers.
Looks good.
Silk pockets. Feel. Feel.
I'm feeling.
Nice.
Yeah. Listen. I know it's a little hard to follow everything that's going on right now, but I just want you to know I love you very much.
Okay.
Okay, Dad.
Okay.
Hello, Adam. I'm Dr. Lee. I'm here to administer your anesthesia.
Okay, hi.
Now just relax. I'm going to inject the anesthesia through your IV. It's going to take a few moments before you start to feel the effects.
You're doing it now.
If you guys just want to head over to the waiting room, that would be great.
And how long does it last?
That really depends on the individual.
Right, but how do you know that it's going to last long enough to, I don't know, wake up in the middle of the surgery, or that you make sure that I'm going to wake up after? Mom? Sweetie, you're going to be just fine.
I'm really sorry, but we need to get Adam to the operating room.
Could you just wait a moment, please?